I'm Dr. Ken Landa. Let's talk about Cialis. Cialis, as everyone knows from the extensive advertising on the television, is a drug for erectile dysfunction, once upon a time known as impotence. It was the third drug in the family. The first was Viagra in 1998, then mid-2003, Levitra, late 2003, Cialis, also known as tadalafil. The drug also gained marketing approval in 2011 as a therapy for benign enlargement of the prostate, but it's principally known as a treatment for erectile dysfunction. Erectile dysfunction can be caused by an enormous number of conditions, ranging from performance anxiety to difficulty at home, emotional problems, psychiatric problems, treatment for psychiatric problems, or some bad habits, maybe drinking too much or smoking too much. It's associated with high blood pressure and the therapy for high blood pressure. It's associated with taking some drugs of abuse, maybe cocaine or amphetamine, maybe some of the opioids. It's associated with heart disease and neurologic dysfunction. And oftentimes we just don't have a good reason for why people develop erectile dysfunction, which seems to be associated with hardening of the arteries. It seems that somewhere around 30 million men in the United States suffer from erectile dysfunction. In the overwhelming majority of men, it's of mild to moderate severity, but about 5 to 10% suffer from complete erectile dysfunction. The older you get, the more likely you are to suffer from the condition. If you're less than 40, only about 5 to 10% of men suffer from ED of any variety. 40-year-old men, well, it increases to about a third. And men over age 70, well, about two-thirds are going to have at least partial erectile dysfunction, with maybe 5 to 10% of those with complete erectile dysfunction. Now, we have to differentiate ED from, say, a problem with premature ejaculation. Cialis doesn't help that. We have to worry about it as a treatment for poor libido. Cialis doesn't help that. It's recommended that you take Cialis in one of two ways. You can either take it when you know you're going to have sexual activity, so at least 30 minutes before the sexual activity. You can take typically 10 milligrams. Some men need 20 milligrams. Some men only need about 5 milligrams. Interestingly, that you can take it long before you're going to have sex. Lasts for about 36 hours in the system. Well, you don't take any more than just one a day. Now, interestingly, instead of taking it as needed for sexual activity, you could take it just one a day. And it's approved at a much lower dose. So instead of taking the 10 milligram a day as needed, now you could take 2.5 milligrams just every single day. You could increase it up to 5 milligrams if necessary. If you happen to have benign enlargement of the prostate, you could take 5 milligrams. And at those doses, you don't have to worry, on a daily dose, you don't have to worry about when you're going to have sex. You just take the pill and you're ready anytime you want. Now, if you take it for benign enlargement of the prostate, you only should take it for about half a year. And during that time, you should be taking either Avodart or Proscar that then takes over, and then you don't need the Cialis anymore. Well, if you're going to take Cialis, you have to be able to have safe sex. So you shouldn't have bad cardiovascular disease. You shouldn't be taking nitroglycerin, because we know that that can cause significant problems. You shouldn't be taking an alpha blocker either for your prostate or for high blood pressure. Have to be a little careful if you're taking Tagamet. And we know that people who have aortic stenosis or have disease of the heart muscle probably aren't good candidates for Cialis. Also, if you had a stroke or a heart attack within 6 months, not for you. And if you have bad arrhythmias, again, probably not for you. Well, the drug can cause some side effects. And for the overwhelming majority of people, the side effects are relatively minimal. They're headache or indigestion or backache or muscle aches, or sometimes people get burping or reflux esophagitis, heartburn. We know that in some people, it can have an erection that lasts for more than 4 hours. See a doctor. They always talk about that on the television. If you have priapism, a painful erection for more than 6 hours, definitely talk to the doctor, because without therapy, either of those conditions can damage the penis, and then the drugs won't work again. Well, sudden loss of vision is possible. It's very unusual. It occurs in 10 or 12 people per 100,000, usually shortly after you begin taking the drug. Usually if you're over age 50, if you're a cigarette smoker, if you have coronary artery disease, and if you have certain eye conditions that predispose you. We also found out in about 2007 that some people taking Cialis or any of the other drugs could suffer from sudden acute hearing loss. Good news is it doesn't interact with a lot of drugs, so for the overwhelming majority of people, there isn't the worry about drug interactions, but you do have to be worried about, well, maybe your liver, maybe your kidney doesn't work well. If that's the case, then a lower dose or just avoid the medicines. How long does it take from the time you first take the drug until it might become effective? Well, in the case of Cialis, it's typically somewhere between 30 and 45 minutes. If you take Viagra, it's somewhere between 30 and 60 minutes. And if you take Levitra, it's a little bit quicker, maybe about 15 to 30 minutes. Now, it is not an aphrodisiac, so don't expect it to stimulate your urge and desire if there's a different kind of problem. The good news is that since Cialis lasts for so long, as I mentioned, that you could take it as much as 12 or even 24 hours before you're going to have sex, and there will be enough left in the system to be effective. Now, if you happen to have mild erectile dysfunction, probably works 85% of the time. If you happen to have moderate erectile dysfunction, only works maybe between 50 and 70% of the time. And if you have severe erectile dysfunction, well, the best you can count on is maybe 1 in 3 men it will help. Now, if you happen to have had a radical prostatectomy, again, the likelihood of the drug working is markedly reduced. And if you happen to have diabetes, only about 50% of the people going to be improved. There are other medications in case the family of drugs, of which Cialis is one, doesn't work, but those drugs aren't terribly appealing. Well, Cialis lasts longer than any of the other drugs in the bloodstream, and it seems to work more on the genital organs and works on the prostate rather than some of the other areas where either Levitra or Viagra might cause some mischief. Now, interestingly, when the drug was first developed by Glaxo Wellcome, now known as GlaxoSmithKline, in conjunction with another pharmaceutical company, ICOS, it was thought not to be really in the interests of Glaxo Wellcome, so they gave up on the drug. Well, ICOS partnered with Eli Lilly, and now it's a phenomenal blockbuster that does around $2 billion worth of sales every single year. Well, to increase the sales, in 2014, Lilly joined with Sanofi, another big French drug company, to market the drug in the United States over the counter. If the Food and Drug Administration gives its approval, they expect that probably in 2018. And as a matter of fact, we know that that's probably a lot safer to take an over-the-counter drug than it is to go and take an internet drug, because the internet seems to be associated with an awful lot of fake or counterfeit drugs. Well, in 2014, the direct-to-consumer ads took the #1 place on the television, and that's boosted the sales of this drug. But we have a problem with the cost of the drug. And the cost of the drug is quite high. If you want to take a 10 milligram Cialis, and you go over to the Walgreens or the CVS right now, you will have to plunk down about $50 to take a pill. If, on the other hand, you're going to take it on a daily basis, 2.5 or 5 milligrams, it's only going to cost you about $12 to $17. Interestingly enough, even though the drug doesn't cost any more to develop, well, just since 2013, when it was relatively early in the marketplace, the drug has doubled in cost. Is there any reason for that? Or is it just that people want the drug and the drug company can charge whatever it wants? Well, in any event, the drug does seem to work. Thanks for watching. I'm Dr. Ken Landau.